Conjunctivitis, commonly known as pink eye, is an eye condition that affects millions. It's the inflammation of the conjunctiva, the thin, transparent membrane covering the white part of the eye and the inner surface of the eyelids. This condition is very common and usually not serious. However, understanding its causes, symptoms, and treatment is important. Conjunctivitis can be contagious, spreading easily through direct or indirect contact. This makes good hygiene practices essential, especially in settings like schools and daycare centers. While it can be uncomfortable, most cases of conjunctivitis resolve within a week or two with proper care. Pink eye got its nickname from the noticeable pink or red discoloration it causes in the affected eye or eyes. The discoloration is a result of inflamed blood vessels in the conjunctiva becoming more visible. While often alarming, this redness is usually harmless and resolves as the inflammation subsides. It's important to remember that self-treating eye conditions can be risky, and seeking professional medical advice is always recommended. Conjunctivitis can arise from various causes, each requiring a different approach to treatment. Understanding the root of the inflammation is key to managing the condition effectively. Bacterial conjunctivitis, often caused by bacteria like Staphylococcus aureus or Streptococcus pneumoniae, is highly contagious. It typically results in a sticky discharge from the eye, often causing the eyelids to stick together, particularly upon waking. Viral conjunctivitis, primarily caused by adenoviruses, is also highly contagious. It often presents with watery discharge and is commonly associated with symptoms of the common cold. Allergic conjunctivitis is triggered by allergens like pollen, dust mites, or pet dander. It causes intense itching, redness, and watering of the eyes. This type is not contagious and affects both eyes simultaneously. Irritant conjunctivitis occurs when the eyes are exposed to irritants like smoke, chlorine, or chemicals in cosmetics. It's not contagious and usually resolves once the irritant is removed. Recognizing the symptoms of conjunctivitis is crucial for early detection and management. While some symptoms are common across different types, others can help differentiate the cause. Redness in the white of the eye or inner eyelid is a hallmark symptom, often accompanied by a gritty or burning sensation. Itching is another common symptom, particularly prominent in allergic conjunctivitis. Discharge from the eye can vary depending on the cause. Bacterial conjunctivitis typically presents with thick, yellow-green discharge, while viral conjunctivitis is associated with watery discharge. Swelling of the conjunctiva and eyelids is also common, making the eyes appear puffy. This swelling can range from mild to severe depending on the severity of the inflammation. Seeking a diagnosis. Self-diagnosing conjunctivitis is not recommended as other more serious eye conditions can share similar symptoms. Seeking prompt medical attention ensures accurate diagnosis and appropriate treatment. A healthcare provider will start by asking about your medical history and any recent exposure to allergens or irritants. They will then perform a physical examination of your eyes, checking for redness, swelling, and discharge. In some cases, a sample of the eye discharge may be taken for laboratory analysis. This helps identify the specific bacteria or virus responsible for the infection, guiding treatment decisions. The healthcare provider will also assess the severity of the conjunctivitis and rule out any other potential eye conditions based on your symptoms and examination findings. Treatment options for conjunctivitis. Treatment for conjunctivitis varies depending on the underlying cause. It's crucial to follow the healthcare provider's recommendations for safe and effective management. Bacterial conjunctivitis is typically treated with antibiotic eye drops or ointments. These medications help eliminate the bacterial infection and reduce inflammation. It's essential to complete the full course of antibiotics as prescribed, even if symptoms improve. Viral conjunctivitis typically resolves on its own within a few days to a week. Treatment focuses on relieving symptoms like redness, itching, and discharge. Over-the-counter lubricating eye drops can help soothe irritation. Allergic conjunctivitis treatment involves avoiding the allergen triggering the reaction. Antihistamine eye drops or oral antihistamines can help relieve itching, redness, and swelling. Irritant conjunctivitis primarily involves removing the irritant from the eye. Rinsing the eye with clean water or saline solution can help flush out the irritant. In some cases, artificial tears may be recommended to soothe irritation. Preventing pink eye. Preventing conjunctivitis involves adopting good hygiene practices to minimize the risk of infection or allergen exposure. These practices are especially important for those in close contact with others. Frequent hand washing with soap and water is crucial, especially after touching the eyes or face. Avoid touching or rubbing your eyes as much as possible to prevent introducing germs or irritants. If you wear contact lenses, ensure proper hygiene, including washing your hands before handling them and disinfecting them as recommended by your eye doctor. Consider switching to daily disposable lenses during outbreaks. Avoid sharing personal items that come in contact with the eyes, such as towels, washcloths, eye makeup, or eye drops. This helps prevent the spread of infection. Keep your surroundings clean, especially surfaces that are frequently touched. Regularly wash pillowcases, towels, and washcloths in hot water to minimize allergen and germ buildup. Seeking professional care. While conjunctivitis is usually a minor ailment, it's essential to seek professional medical advice for proper diagnosis and treatment. Delaying care can lead to complications or prolonged discomfort. If you experience any symptoms of conjunctivitis, consult a healthcare professional. They can determine the cause, severity, and appropriate treatment plan for your specific case. Early diagnosis and treatment are crucial, especially for bacterial conjunctivitis, to prevent the infection from spreading to others or causing complications. Remember, self-treating eye conditions can be risky and may worsen the condition. Always consult a healthcare professional for safe and effective management of conjunctivitis.